Good afternoon, guys. Welcome to Keep Calm and Nest On YouTube channel with me, Cindy. I'm a BSN and RN, and on this channel, we are dedicated to sharing as much health information as possible because your health is so much important, and we also want to help our fellow students to prepare and study effectively for their exams or their knowledge. Yeah. So, guys, I would like to welcome our new subscribers, our new family members to our channel. Thank you so much for subscribing and being part of our family. And to our old family members, I would like to say I'm so sorry for not being consistent with the lessons for the past few months. Hopefully, going forward, we are going to be having more time for us to share these lessons with you. So, guys, without wasting much of the time, let's start our today's lesson. So, we are going to start our therapeutic series or pharmacology series. And to start with, we are going to start with the drugs that are used in hypertension. So before we start looking on drugs, or before we start studying about these drugs that are used in hypertension, it is important that we revise or we remind ourselves about what hypertension is. So let's get started. What's happening? So guys, hypertension can be defined as a common chronic disease which involves a persistent elevated blood pressure of more than 140 over 90 millimeters of mercury. So in short, hypertension is simply a common chronic disease in which there is persistent elevation of blood pressure of above 140, which is the systolic, and 90 millimeters of mercury as diastolic. So when it comes to types, we have two types of hypertension. We have what is called essential or primary hypertension. So essential hypertension is that hypertension which is due to unknown pathological etiology and is the most common, and it accounts for 90% cases in most patients. So to simplify this, we are saying primary hypertension, which is also called essential hypertension, is a type of hypertension in which the pathophysiological causes or the etiology is not known. So what is causing the blood pressure to rise or to increase is not known. And this is the most common form of hypertension in most cases. Then the second type of hypertension we have is called non-essential hypertension or secondary hypertension. This one accounts for 10% of cases. Patients have specific causes of the hypertension. These are mostly concurrent medical conditions, or they are endogenously induced. So in secondary hypertension, there is a known cause. So there is a specific cause that is causing the blood pressure to rise, and that cause is known. So the causes would be it would be due to another medical condition. So this simply means that because the cause is known, therefore this type of hypertension can be treated completely. So here we are saying that because the cause is known for this type of hypertension, it is likely to be cured. Unlike in primary hypertension, where we do not know what is causing the blood pressure to increase. Hopefully that makes sense. So now when it comes to management of hypertension, we have different drugs that we use. So to start with, and we are going to look at those different drugs as we move on. Now to start with, we are going to start with the diuretics, which are one of the most common drugs used in the treatment or management of hypertension. Now, what are diuretics and where do they exert their effects? So the mechanism of action and sites of action are as follows. Diuretics are drugs that slow down the absorption of salt and fluid in the kidney tubules, thereby increasing the volume of fluid excreted by the urinary system. So in simple terms, we are saying diuretics are drugs that slow down the absorption of salts and fluids. So we know that absorption simply means bringing back the things into the systems. Now in this case, we are talking about the salts, the electrolytes and fluids, bringing them back into the urinary system, into the body. So let's continue with our discussion. So the effect of diuretics is based on their ability to inhibit the absorption of electrolytes by the kidneys, resulting in the acceleration of urine flow from the kidney. So to simplify this point, we are saying that the effects of diuretics is based on the knowledge that when the absorption of electrolytes is inhibited by the kidneys, it will result in increased acceleration or increased urine flow from the kidneys. So this simply means that if the salts and the fluids are not being absorbed or reabsorbed back into the system, it means they are going to be lost through the urine, and it simply means that the amount or the volume of urine is going to increase. And when we increase urine output, it simply means that we are reducing the volume of blood in the body, leading to the reduction of blood pressure. So, enhanced elimination of electrolytes is accompanied by an increase in the volume of fluid excreted from the body through osmotic pressure. So this point is telling us that when elimination of electrolytes is enhanced, it will result in increase in the volume of fluid being excreted from the body. So in short terms, we are just increasing the amount of urine being lost through the urinary system. And when we do that, we reduce the volume of blood It means we are going to reduce the blood pressure. So now, I hope that was clear. So moving on, we are going to look at the different types of diuretics, because we have different classes of diuretics which work at different parts of the nephron. So to start with, we are going to look at the loop diuretics. So the examples of loop diuretics are furosemide, toracinamide, butamide, and erythroic acid. So now, when it comes to the site of action, where do these loop diuretics work? From their name, we can tell that these drugs simply work on the ascending loop of Henry. So this is the part of the nephron where these drugs target, the ascending part of the loop of Henry. So these drugs, when they are taken, they come to work at this site. Now, what do they do at this part of the nephron? So ascending loop of Henry, where they inhibit the protein or enzyme called the sodium potassium chloride transporter. So they inhibit the function of this protein or the transporter, and if the protein or the enzyme is inhibited, it means it won't work. So when it is inhibited, and thus preventing the reabsorption of ions with water following by osmosis. So to simplify this point, what we are saying is that these loop diuretics, when they are taken, they go at the site called the loop of Henry, the ascending part of the loop of Henry. And at this point, we have the enzyme or the protein, which is called the sodium potassium chloride transporter. So now its function is to reabsorb, to transport the electrolytes from the urine which is being formed back into the system, back into the blood. So that's its function. So when this transporter is inhibited, when its function is prevented, it means the reabsorption of these ions is going to be inhibited. As a result, the ions will go through the tubules, and if they go in the tubules, water will also follow by the process of osmosis. So to simplify this, we are simply saying that when loop diuretics are taken, they act at the ascending part of the loop of Henry, where they inhibit the enzyme sodium potassium chloride transporter. And when they inhibit this transporter, it means these electrolytes are not going to be reabsorbed back into the blood. And if they are lost, it simply means it will cause the water or the fluid to follow through osmosis. So apart from that, they also work by a secondary mechanism, namely dilation of capacitance veins, an effect which reduces preload and enhances the contractile ability of the cardiac muscle. So this point simply means that when those fluids, when we lose the fluids and the electrolytes, in simple terms, we are saying we've increased urine production, which has caused reduction in the blood volume. So it simply means that even the preload, the amount of blood in going to the heart is going to be reduced. And when the amount of blood going to the heart is reduced, it means the contractility of the heart is going to be enhanced or improved. So that was the mechanism of action and the site of action for loop diuretics. Now let's look at the indications and side effects of loop diuretics. For indications, we have first hypertension, the conditions that we are talking about. In hypertension, we want to reduce the blood volume, because when we reduce the blood volume, we are going to reduce blood pressure. In congested cardiac failure, we also want to lose those fluids in the extracellular compartment that sits in there due to the condition. Then also in pulmonary edema, when we have accumulation of fluids in the lungs, which is going to affect the function of the pulmonary system. We don't want fluids in the lungs. So if we want to get rid of those fluids, we are going to use loop diuretics. Then also in hepatic renal dysfunction, such as ascites, when we have those fluids in the extracellular compartment causing ascites and swelling, if we want to manage that, we can use loop diuretics. So when it comes to side effects, we have hypotension. Yes, hypotension will simply come about due to loss of fluids, because when we reduce the blood volume, we are reducing blood pressure. So there is a risk of having hypotension. Then we also have hypokalemia, because these electrolytes are being lost through the urine. There's the risk of having electrolyte imbalance. Then hyperglycemia and electrolyte imbalance, as discussed already, and elevated serum creatinine concentration. There is also a risk of ototoxicity and nephrosis. So these are some of the side effects for the loop diuretics. And guys, we've come to the end of our discussion about loop diuretics under the series drugs that are used in the management of hypertension. So next we are going to look at thiazides and potassium pairing diuretics, and we'll continue to look at other drugs that are used in the treatment of hypertension. So guys, thank you so much for watching. If this video was of help to you, please give it a like, and please subscribe to the channel, and you can share the video so that others can also benefit from it. Thank you so much. Have a blessed day. Bye.